Good morning, friends. Having a nice Sunday today. I'm bringing the next video on cataract. We already discussed about frequently asked questions on generally about cataract. So today we'll deal with some frequently asked questions about cataract surgery. What all, because more than the diagnosis and investigations, it is the surgery which the patients are worried about, and they have lots of queries on how to go about cataract surgery. So the first question which comes in our mind, in everybody's mind, is when to do cataract surgery. The patient has got cataract, the doctor has advised cataract surgery, the patient has to decide when to get it done. So when to do it. So it can be seen in two aspects. One is the vision aspect. Once the vision has started reducing and started affecting day-to-day activities of a patient, then there is no need to wait. So anytime the cataract can be removed. The other aspect is the patient has not experienced vision difficulties because he is compensating with one eye. The other eye is more cataractous than the good eye. The good eye is seeing, and he doesn't know that he or she doesn't know that the cataract in the other eye is affecting his vision. This is one scenario, for example. So in that case, the doctor sees and then he says it is ready to get operated and you have to go ahead with surgery. Then that is one scenario where you have to decide on the timing immediately. So how long can cataract surgery be postponed, or can you wait for cataract surgery? That again depends on lot of factors. How mature the cataract is, or how immature it is, how it is affecting your day-to-day activities. And waiting for long and allowing it to become mature is not a good thing. So that is one point any doctor, eye doctor, will tell you. So once it reaches mature stages, then it starts giving problems like glaucoma and increased pressure, loss of vision, totally loss of vision, so many complications. And even doing the surgery, performing the surgery becomes technically difficult when we allow the cataract to mature. So it is not a good thing to allow it to mature, but if you have to postpone, then your surgeon can advise on how long. It's like a graying of hair, I told you. So how long hair will take to gray, nobody can give you an answer. So it is difficult to say how long it will take for your cataract to go to the next stage. It may even go to the next stage in one day, in 1 month, or it may take 6 months to 1 year to go to the next stage. So it is a difficult thing to predict, but eye surgeon can give you a rough estimate on how fast your cataract is growing and when it has to be taken out. So the next question is, what is done during cataract surgery? What is done during cataract surgery is the lens is removed, the cataractous lens. The lens which has become as cataract is removed, and artificial lens is implanted inside. Artificial intraocular lens, we call it, that is placed inside. This is what is done. So the next question is whether it's a major surgery or a minor surgery. Any surgery is major. There is nothing called as minor surgery. And eye being small doesn't make the surgery small. No, the surgery is a very major one, not life-threatening. That much any surgeon can tell you. It's not life-threatening like other parts of the body where heart is opened and where life is at stake. Here that is not the case, but still I would say it is a major surgery because lot of precision is required, lot of sterility is required, lot of precautions are taken to maintain that sterility. And if infection is not taken care of in the operation theater, in the post-operative care, then you may end up with complications which can even affect your vision permanently. So it is a major surgery. People have started taking eye surgery very lightly. They come in the morning and then it's only a 5 minutes procedure. It can be done and you can leave the hospital. So it becomes a very minor procedure. No, it's not like that, but it's a relatively safe procedure. So it's not a very risky thing to be afraid about. So then the next question is whether you need admission for cataract surgery. No, admission is not required. Most of the times it can be taken care as a daycare procedure, but it's not a OP procedure. People mistake it for OP procedure. It's not a OP outpatient procedure. It has to be done in operation theater, not in an outpatient clinic. Unlike mentioned in many of the Google sites, which will tell you even eye care centers can do cataract surgery in the OPD. No, it's not like that. Utmost care has to be taken regarding, as I told you, about infection and other thing, cleanliness. So that is very important. So because it is daycare, whether insurance companies are supporting this, yes. Even though it has become a daycare procedure, all insurance companies, almost all of them, support eye care surgery, and how much they support, that depends on the insurance companies. So you may have to inquire with them and find out. So how long does the procedure take? The procedure itself takes 15 to 20 minutes, depending on the type of surgery and the surgical skills and other factors taken into consideration. But you will need a day, half a day to 1 day to be spent in the hospital to complete the whole process of investigation and getting the surgery done. You are in a list and go accordingly. And then next comes about post-operative care. Post-operatively, what precautions you have to take. Post-operatively, main thing you have to take care of is cleanliness. You have to be very clean. In and around the eyes has to be kept very clean. They will teach you how to go about and clean your eyes and apply drops. You will need drops for 15 to 30 days. And you have to be very clean. And activities, maybe for 3 to 4 days you may have to restrict yourself from watching television and gadgets and things like that, not because of any harmful thing going to happen, but just to give rest for healing. That is the only thing which you have to. Otherwise you can get back to your routine activities, non-dust related activities. It should not have dust exposure. At least for 2 to 3 weeks you should be very careful. You can wear they will give you protective goggles to be worn. And usually what tests are done for cataract surgery is another question, where you are required to do tests according to your comorbid conditions and routine investigations, lab tests, blood sugar, BP, ECG, and if you have comorbid condition, then you may require to get a certificate from your treating physician or a cardiologist or the neurologist to that it is okay to, and what drugs to be stopped before surgery. All that has to come from your treating physician. Another important question is how much blood sugar is okay for cataract surgery. Is a very common question people ask us. Less than 200 milligram is ideal, and HbA1c of 6 to 7 is very ideal. And there are exceptions in emergencies where we take in, but the chances of getting infection is high when we operate with high blood sugars. So that is why the doctors insist on reducing your blood sugar levels. And next question is, how old can a patient be? The patient is in his 90s, in her 80s, whether surgery can be done. Yes, it can be done. There is no absolute contraindication of related to age, but the patient has to be at least ambulant, should be able to lie down flat on the operation table, and should be able to follow few instructions which is given during because We don't anesthetize the body fully when we do cataract surgery. We just give injections near the eye or apply drops to make it painless. And the next question about anesthesia is, how painless is the surgery? Any surgery has to be painful, that is science. But we make sure with anesthesia, with local anesthesia, with general anesthesia if required, and try to make it as comfortable as possible. And it is not done with pain. It is difficult to perform the surgery with pain, so that surgeon makes sure that you are comfortable and you are painless. And again, as I said, the post-operative care is very important. You have to be very careful applying the drops, cleaning hands and applying it, and stay away from infection. That is very important. Then about intraocular lenses. What are the types of intraocular lenses? What is placed inside? This is again a very technical subject. It may take another video by itself, but I would just give you a few tips. There are multifocal lenses, monofocal lenses, which according to your requirement will be placed inside. And all these lenses, what they do is they give you good clarity of vision, and they make your vision near normal, as much near normal as possible, how it was before surgery. But whether it will become normal is not totally possible, or it happens sometimes. We calculate all our calculations all done for for normal, but it may end up with there is always a room for but what these lenses do is they reduce the dependability of wearing glasses after surgery. That is the next question, all patients, whether we need glasses post-operatively. Depending on the intraocular lens placed, you may or may not need glasses full time. A multifocal lens reduces the dependability more than the monofocal lens. Multifocal lens takes care of near vision also, but monofocal lens takes care only of the distant vision. So discuss with your doctor, with your surgeon, what is the best lens according to your requirements. Housewives need a different requirement, a painter needs different requirement, architect needs a different requirement. So that, depending on that, your surgeon will suggest which is the best lens for you. And another thing which I wanted to clarify, even though it's not a question, I wanted to clarify is, what is the part of laser in cataract surgery? See, lasers in cataract surgery is a misnomer actually. Lasers are not actually used in the procedure. What is used is ultrasound, which is emulsifying the lens, and then through a tube it is sucked inside. What these days with development, lasers have started being useful in cataract surgery for cutting the lens into parts and marking the opening in the layers. So those kind of the lasers are assisted. So what it has become is laser assisted cataract surgery. So it's not, the whole procedure is not performed through what people think is, you just go and sit on a slit lamp or a machine, and then laser is given and then you can come out. No, that is not the case. You have to go to an operation theater. You have to get yourself operated. A small opening is done, and then a tube is inserted inside. It is not OP procedure, as I mentioned before. So hopefully I have clarified a lot of the doubts, and if more doubts, please you can mention in the comments box. I can reply. Thank you. Have a nice day.